Are annual physical exams worth your time? Here's what science says. Welcome to the official GlobalRPh YouTube channel. If you haven't already, hit that subscribe button to stay updated with our latest videos. The annual physical exam has long been a staple of American healthcare. For decades, it has been recommended to assess overall health, detect early signs of disease, and guide preventive care. Recent studies, however, show that these exams may be linked to a 45% reduction in all-cause mortality, despite ongoing debates about their effectiveness. This video explores the scientific evidence supporting the value of yearly physicals, while also examining where they may fall short. What is an annual physical exam? An annual physical exam is a thorough health check performed when a patient is feeling well, designed to establish baselines, identify potential risks, and promote preventive care. It differs from episodic visits, which are typically focused on specific health complaints. Primary care providers typically perform the exam, which includes a range of measurements such as blood pressure, height, weight, heart rate, and respiration rate. The exam includes a visual check for conditions like skin abnormalities, along with a cardiovascular assessment, lung auscultation, abdominal examination, and checks on the nervous system and extremities. Routine laboratory tests are often incorporated to evaluate cholesterol levels, blood glucose, thyroid function, and nutritional status. Why annual physicals are important. Annual exams offer several key benefits. First, they establish a baseline for health metrics, enabling providers to identify subtle shifts that may signal the early stages of disease. These exams also provide an opportunity for health education and preventive interventions, such as lifestyle modifications, vaccinations, and screenings based on age and medical history. Further, regular exams foster a relationship between patient and healthcare provider, enhancing continuity of care. They also serve as a dedicated time for patients to raise health concerns that may not otherwise merit a separate visit. Importantly, early detection of conditions like hypertension, high cholesterol, or cancer can lead to more effective treatment and better long-term health outcomes. What does the science say? The evidence on the effectiveness of annual physical exams is mixed. While many health professionals advocate for them, randomized clinical trials, RCTs, have often failed to demonstrate a clear benefit in terms of mortality reduction. For example, the Southeast London screening study, which involved thousands of adults, found no significant mortality difference between those who received annual health checks and those who did not. However, these studies did show positive outcomes, such as the earlier detection of chronic conditions like hypertension, which is crucial for better management. Other studies have shown increased uptake of preventive services like cancer screenings and improvements in patient-reported outcomes, such as quality of life. Conversely, observational studies paint a different picture. For instance, a meta-analysis of 7 observational studies found a 45% reduction in all-cause mortality for individuals who received annual physicals. This suggests that routine exams may offer substantial health benefits, although the findings contrast with the results of RCTs. Which parts of the physical exam are most useful? Some components of the annual physical are more valuable than others in improving health outcomes. For instance, blood pressure measurement is universally recommended and can be a critical part of detecting hypertension. The U.S. Preventive Services Task Force, USPSTF, recommends routine blood pressure checks every 2 years, as nearly 1/3 of U.S. adults have hypertension. Body mass index, BMI, is another important measurement, particularly since obesity is a major risk factor for hypertension, diabetes, and cardiovascular disease. Regular cancer screenings, such as mammograms, pap smears, and colonoscopies, are also crucial elements that can lead to early detection of serious conditions. Other aspects like lymph node palpation or routine laboratory tests without specific symptoms often lack strong supporting evidence and may not provide significant value in the absence of other risk factors. The limitations of current research. While randomized trials suggest limited benefits in terms of mortality reduction, observational studies often show positive associations with health outcomes. These contradictions may stem from methodological issues, such as sample size, follow-up duration, and the lack of control for confounding factors. Moreover, some of the earlier studies cited against annual physicals are outdated and may not reflect current evidence-based practices. Despite these challenges, many healthcare providers continue to believe that annual exams are essential for detecting subclinical illnesses and promoting patient engagement. A survey found that 74% of primary care providers felt these exams were valuable in improving early detection, even when the data didn't consistently show mortality benefits. Do annual exams improve health outcomes? Annual physical exams serve as a critical tool for early disease detection. They provide opportunities to identify conditions like high blood pressure, elevated cholesterol, and diabetes before symptoms develop, improving the likelihood of successful treatment. For example, catching cancer in its early stages significantly increases the chances of effective treatment. Some studies have also shown that individuals who undergo routine checkups tend to have better health outcomes, including improved cancer screening rates and vaccination uptake. Regular exams can lead to better chronic disease management by offering structured opportunities to track disease progression and adjust treatments as necessary. However, the evidence for mortality reduction is not as clear-cut. Although some observational studies report a decrease in all-cause mortality with annual exams, randomized trials have not consistently shown these benefits. This disparity reflects the complexities of evaluating preventive care measures and suggests that further research is needed. Not everyone needs an annual physical. The frequency of exams should be tailored to the individual's health status, risk factors, and age. For healthy adults under 40, exams every 2 to 3 years may be sufficient, while those over 40 or with chronic conditions may benefit from more frequent visits. Age-specific recommendations include routine blood pressure checks, vaccinations, and cancer screenings at appropriate intervals. For healthy individuals with low risk, annual exams may provide limited additional benefit and could result in unnecessary testing. In such cases, alternatives like periodic health exams or Medicare wellness visits may offer a more cost-effective and targeted approach to preventive care. Alternatives to annual exams. While annual physicals are valuable for some individuals, other preventive care models may be more suitable for others. Periodic exams, conducted every 2 to 3 years, can provide structured preventive care without the costs of annual visits. Additionally, opportunistic screenings, which occur during sick visits or follow-up appointments, offer a more flexible and targeted approach. Medicare offers wellness visits, which focus on preventive planning rather than thorough physical exams. These visits can be particularly useful for assessing individual health risks and creating personalized care plans without the need for a full physical. Conclusion. Annual physical exams remain a cornerstone of preventive health care, but their value may depend on individual circumstances. The evidence supporting their benefits is mixed, with some studies showing improved health outcomes, while others fail to demonstrate a reduction in mortality. Essential components such as blood pressure measurement, BMI calculation, and cancer screenings offer tangible benefits, but some traditional practices may be less impactful. Rather than adopting a one-size-fits-all approach, healthcare providers should tailor the frequency and components of physical exams based on individual patient needs, risk factors, and evidence-based guidelines. Ultimately, the goal is to provide the most effective care, balancing preventive measures with patient comfort and resources. Key takeaways. Observational studies suggest that annual exams may reduce all-cause mortality, but randomized trials have not consistently shown this benefit. Blood pressure, BMI checks, and cancer screenings are valuable, while other components like routine lab tests may offer limited value. Annual exams are not necessary for everyone. Adults under 40 with no risk factors may require exams less frequently. Alternatives like periodic exams and wellness visits offer effective, cost-efficient preventive care. Providers should personalize the frequency and content of exams based on patient needs and risk profiles. If you found the content valuable, please consider subscribing and giving this video a thumbs up. Your support helps us continue delivering high-quality, evidence-based medical content tailored to healthcare professionals like you. We have more in-depth topics and clinical insights coming soon, so stay tuned and we'll see you in the next video.